Welcome to week 2 of Global Health 620. You should have already submitted quiz 1 and posted on discussion board 1 in Canvas. As noted in the syllabus, late assignments will result in a 25% grade reduction per day. Please reach out via email if you did not meet the deadline or to discuss any issues with other established deadlines. If you're emailing me outside of Canvas, be sure to send the email with GH620 in the subject line. This week, we'll review textbook concepts and the working assignment. According to the syllabus, you should have read chapters 1 through 3 by Monday and chapter 4 by Friday. You should notice on Canvas under week 1 and week 2, I've posted all of the PowerPoint presentations that were provided by the textbook publisher for chapters 1 through 4. That may help you prepare for test 1, which will cover selected concepts from each of the first 4 chapters. I mentioned last week that tests will be open book and open note and open internet. I'm developing a 30 to 60 minute test that should be posted by this Friday and due next week. Tests are designed to be easy as long as you've read and annotated the assigned chapters. The book doesn't bold or underline key definitions and concepts very often, so you may want to do that underlining or highlighting as you read through each chapter and add additional notes to the book or chapter PowerPoints. That way you can find concepts quickly during the test. After you've decided on your reportable disease or condition of interest, some students will want to read ahead in the book, particularly to find more information for your research project. I went ahead and posted all the PowerPoint presentations that the publisher provided. So you can find those for weeks. You should be able to find those for weeks 2 through week 7 in Canvas. One example might be a student who chose to study lead poisoning, for example. They may find information in Chapter 11 useful, even though Chapter 11 hasn't been assigned until after the midterm. A student studying malaria might want to read chapters 7 and 12 and parts of other chapters. Basically, students who use the index will find different chapters useful before and after the midterm. We'll talk more about that and assignments and the final paper later on. First, I want to review a couple of issues with assignment 1. Based on the quiz and discussion boards, some of you found it pretty easy to choose 1 or 2 appropriate reportable diseases and areas of interest. Many of you picked reportable diseases from your state or from Kentucky's list. However, some of you picked 2 highly unrelated diseases. Moving forward, I'd encourage all of you who picked 2 unrelated diseases to choose only 1 disease or condition of interest. Pick your 1 favorite reportable disease or condition and focus on only that 1 disease or condition across the geographic areas of interest. Do that for assignment 2 and the rest of the term. Unless you're very eager to study 2 diseases and they're highly comorbid or associated, it'd be best to focus on just 1 for the paper and related assignments. Assignment 1 scores will be based simply on having the appropriate responses and addresses. Later in the term, I'll score you on accuracy of your estimates and additional content, clarity of communications about area comparisons, and your intervention recommendations that should be represented in maps. I've posted a final project rubric using an Excel format that may be helpful as you prepare tables that will be due in assignment 2. Next week or the following week. Some good project ideas I've noticed should be narrowed down, and these include comparison of TB or dengue across Florida and India, drug-resistant staph infection across Cincinnati and India or possibly Saudi Arabia, malaria or HIV across parts of Florida and or parts of India, measles across parts of New York and India, and more on these projects later. This is just some of the projects I'm looking through right now that need to be narrowed down. Getting back to the concepts that you will be tested on, I'll start with chapter 1. So far, your assignments and reading have addressed the relationship between decision-making and data. Last week, we reflected on the 1948 as the year that the World Health Organization was established. A public health historian might be interested in the range of criticisms that were published about the WHO and the United Nations during that period of time. That's 1920 to 1948, as the UN was replacing the League of Nations after the World War I and Paris Peace Conference failed to maintain peace, health, and safety in Europe. As an MPH, it's really critical that you understand the origins and purpose of internationally agreed upon definitions of health and disease. Today, all functional states monitor their population's morbidity and mortality rates using death certificates and census. Different states, territories, and countries may collect a range of different information on reportable diseases as you're discovering in your project. Our ability to calculate disease incidence and severity depends on many thousands of hospitals and clinics and coroners cooperating in data collection. We will look at ways census data and other publicly and privately available survey and research data might be used to estimate consequences, health, social, economic consequences of morbidity and mortality on different populations affected. Make sure you're familiar with how to find different options for measuring incidence density, cumulative incidence, prevalence, as they're found in Chapter 1 and applied in different situations. For assignments 1 and 2, you should be examining mortality and other essential epidemiology concepts across 2 states or districts within nations. When you're tested on these concepts, be sure to have book chapters available so you can find tables and definitions, including measures we use to calculate incidence rates, prevalence, mortality rates, as these sometimes contribute to other population indices and composite measures. You should understand the reasons for estimating quality-adjusted life years, healthy life years, disability-adjusted life year, and comparing populations with other composite measures, in case they're useful to you when selecting among interventions in different countries and regions. Consider several tables, including this one in Chapter 1. Chapter 1, page 25, and Chapter 2 provided us with brief analyses of disease burden in different countries, and assigned videos and discussion boards will continue to think about ways that the world has changed from 1948 to 2018 and from 2018 to 2025, and the widespread ongoing critiques of the World Health Organization and cuts in U.S. funding for the WHO and CDC that may be compromising UN Sustainable Development Goals and objectives. What is important for the test is that you're able to find the definitions of key measures and concepts in the textbook, and you select among them for your own transnational study. Again, Chapter 2 provides brief analyses of the disease burden in different countries, but there aren't as many measures to be tested on in this chapter. You should be aware of basic concepts in medical anthropology and approaches to studying cross-cultural health behavior. Some of these theories are still applied, so it is important that you're aware of these models and approaches as they're applied in prevention interventions and behavioral health clinics. Interestingly, the harm reduction model is currently under heavy scrutiny, and I may cover executive orders on next week's discussion board assignment. We have learned in Chapter 3, page 78, how ethics can guide approaches when a conflict arises between competing values or needs It is important to understand the background for documents like the Belmont Report and related concepts and principles from the Nuremberg trials. And these are covered in Chapter 3. Health is mentioned only once in the 1948 Declaration on Human Rights, and it is within the context of an overall standard of living. Be aware of these sorts of definitions contained in Chapter 3. It's important that you're able to define global health in the context of human rights and ethics. In some states, constitutions provide for justice and the general welfare or well-being of the people, and global threats like infectious diseases can test the abilities of different states and countries to uphold these principles and ethics across populations. As described in Chapter 3, human rights frameworks are dependent on state-based systems of governance. It is important to understand state laws that support reportable disease research and the ethical concerns that come with priority spending on one disease or population over another. It's important to understand the limitations of documents like the Universal Declaration on Human Rights. Chapter 3 reminded us of ethical issues driving HIV/AIDS, Ebola, polio, and the recent Zika outbreak. This week we'll discuss U.S. and international differences in human rights and ethics surrounding contraception and abortion control in the U.S. and Central or South American countries. And we may touch on outbreaks linked to malnutrition and warfare in other parts of the world. Chapter 4 included social determinants of health and health equity. Health equity is still another concept being heavily scrutinized and defunded by U.S. federal government efforts. It's important for you to be able to analyze the relationship between disease and the social and material environment. Chapter 4 includes several important definitions and provides a few figures that you may find useful. This is the first example where multi-level social and environmental determinants are illustrated with healthcare services included as only one intermediate level factor, along with housing, water, sanitation, and other factors. There are other useful figures in this chapter as well. Some of the figures in Chapter 4 represent different conceptual frameworks that may help you understand and evaluate social and economic conditions. In your first assignment, you began identifying nodes or addresses in the local public health system in two areas. Some of the readings within Chapter 4 describe ways health systems determine outcomes in different countries and actions to address health equity and inequities. You may be asked to define and differentiate these concepts for the test. As you prepare for the test, consider all discussion questions in chapters 1 through 4. Next week, I'll post assignment 2, and it will include some application of Chapter 4 concepts, possibly the key medical and non-medical determinants of disease outcomes in your areas of interest and additional features of the health systems. I'll show you how the government's executive orders have suspended or terminated some of these programs and initiatives recently. Going back to my own working example, HCV, there are basic facts and estimates I found in Chapter 6, including global and regional prevalence rates and principal modes of transmission, that is, injection drug use and blood transfusion. I've done some previous research on this topic, so I already know that baby boomers and native and non-native subgroups and time in prison are all important population risk factors in the United States. I added birth cohort and related variables to my table. I was reminded by reading Chapter 6 that a large proportion of HCV has been attributed to blood transfusions in healthcare systems that don't adequately screen out hepatitis and other viruses, so I added unscreened transfusion to my table, although I do believe in systems in Kentucky and Hong Kong that they more than adequately screen out HCV today. Looking at some of the figures in Chapter 4 helped me think about main determinants of health and how social and environmental policies could affect etiology and epidemiology. I'll post more specific details for assignment 2 next week. I just wanted to talk through how you should be using your textbook not only to prepare for the test, but also to develop your assigned tables and research paper due at the midterm. By midterm, your project should include a state reportable disease profile that refers to working tables and figures. These tables and maps should represent appropriate estimates and evidence of transnational analysis. Read the project rubric and syllabus for a simple description of what be assigned and due, including elements of the final paper and presentation. As you continue to work on your research paper, make sure you select among the most critical and important risk indices. For example, a student who picked lead poisoning last semester mentioned that the estimates she found for mortality rate were not very high, and she was concerned mortality rates may be difficult to find for lead poisoning in Mexico. She was exactly right, and we talked about some of the other health-related metrics and indices that are found in Chapter 1, Table 1 specifically, particularly the notion that paternal and maternal exposures are important, and incidence rates or hospitalization rates among children with acute lead poisoning may be more important than case fatality rates and other kinds of risk indices. Her reportable disease profile included other kinds of estimates. Chapter 1, Table 1 encouraged us to think about anthropomorphic indicators of lead poisoning. In this case, hospitals may detect acute encephalopathy, brain swelling, or even comas and death from severe lead poisoning in children. There's a wide range of other short and long-term effects of lead poisoning, and there may be higher rates of mortality than you'd expect if you can find estimates for children under 5 years old. Now that you've picked, or at least narrowed down your topics, you should jump to chapters in the textbook that address specific aspects of your topic. Checking the index we find for the lead poisoning example, Chapter 11, Methods for Environmental Health Research. We can borrow concepts from Chapter 14 and 11. And reportable disease profile would address different agents, features, and risk factors to consider in control and prevention initiatives in each of the populations of interest. So Chapter 11 includes one way to graph cognitive development scores using IQ measures and postnatal blood levels across groups. We know lead has long-term effects on IQ, attention span, risk of anemia, and long list of associated developmental problems and impairments. This final research project that was submitted last term considered different ways social and environmental determinants of health could address different areas where large numbers of parents may be working on lead abatement projects or in factories with lead exposures that they bring home to infants and toddlers, and contaminated products like paint chips and dust and other particulate matter. Think through your own projects in this way, and next week, going into the midterm, after you've read through all the assigned chapters, if you need more specific guidance, let me know and I'll try to find a case study or example related to your specific disease group that you're working on. Finally, in your syllabus, I included a recommended weekly virology podcast. They cover all kinds of things in that. You can search amongst the long list of former shows, or you can listen to the editorial series by Paul Offit. Vincent hosted Paul for editorials focused on the presidential campaign, and they continued to post really in-depth science discussions and also political updates. I'll leave you here with these and have no graded reflection assignment. Just prepare for the test and have a good evening.